What a difference 5 years makes. Nurses in BC are no longer required to get the flu vaccine or wear a mask in patient care areas after a new agreement was reached with the Health Employers Association of BC this week.
So the nurse will make a decision based on the evidence presented to her during flu season, whether the flu vaccine is the right choice for him or her.
But back in 2014, there was no such wiggle room. If a healthcare worker refused to get a flu shot, then they had to wear a mask or face disciplinary measures. Nurses argued it confused patients and made it difficult for some to hear what was being said. But the province stood firm, calling it a matter of life and death.
We lose about 500 people every year that die from the flu. This is not something to, shrug about. This is something we need to take positive action.
And the medical health officer in 2014 backed him up.
We know that influenza vaccine works. It protects us and it protects our patients. We know that masks work as well.
The latest statistics from the Health Employers Association of BC shows 79% of all healthcare workers who work in residential care got the flu vaccine, while 76% of healthcare workers in acute care, that includes hospitals, are immunized.
Some of the systems we have in place, I think, haven't been working well enough. So we're sitting down and working with nurses to see that they get that we raise levels of immunization by not being punitive, but by working together to raise those levels. And I think that's what we're doing.
Nurses are very well-educated professionals. They are able to weigh evidence and make decisions on evidence. They do it every day in their jobs.
The agreement does require the health authority to track those healthcare workers who continue to refuse a flu shot. And in the case of an extreme flu outbreak, the influenza prevention policy, including masks, will be reinstated temporarily. Deborah Goebel, CBC News, Vancouver.